global picture, get reaction on what is the world's largest lockdown currently, India. The largest, world's most populous countries. In fact, it is one of them, with at least 1 billion people. Above that, the Prime Minister Narendra Modi has imposed a 21-day nationwide lockdown, all in an attempt to slow the spread of the coronavirus as well. There have been 519 confirmed cases across India and 10 reported deaths. India correspondent Rebecca Bandan has the latest for us now live from Mumbai. Rebecca, good to speak to you. So, the first day of what's been described as the largest lockdown in the world currently, how's it gone?
Well, this has been the first day of the 21-day lockdown, a 3-week lockdown that was announced by Prime Minister Narendra Modi on Tuesday evening, just a few hours before it came into effect. Now, the number of cases, confirmed cases of coronavirus in India have been relatively low at about 600. But the real worry here is that many medical experts are saying that testing has been very limited in India, and therefore the real numbers could be much, much higher. And the major concern is the coronavirus spreading rapidly in a country of 1.3 billion people. And that's why Narendra Modi, India's Prime Minister, has taken what many are describing as quite an unprecedented measure that's been introduced. Now, on the first day of the lockdown, people did largely stay indoors, as they've been instructed to do. However, one of the things that people are allowed to go out for is essential supplies. And with this lockdown being announced at quite short notice, a lot of people have been concerned about how they're going to get groceries, medicine. So we really saw a rush of people going to the stores. So people were out and about, going to grocery stores, going to pharmacies and stocking up on these kind of goods. And in a lot of those cases, what I saw today was people were crowding around these stores and there was no social distancing whatsoever. There were some shops that were trying to enforce social distancing and limiting the number of people that could come in at one time, making people queue up. But others, for example, there was a gas centre where people were going to get gas canisters and they were just crowding outside all around each other, and there really was no social distancing at all. So this is one of the problems in a country where you've got such a large population and the density is very high as well. People, especially in a city like Mumbai, do live in very crowded areas where it's very hard for many people to keep themselves away from each other, given the lack of space.
And India also, Rebecca, has quite a significant number of poor people. What is being done for them during this lockdown when those who can afford are stockpiling goods, fuel and the like?
That's really a worry for India, because there are a lot of people that do live hand to mouth, and these daily wage labourers, their work has stopped in a lot of cases because taxis aren't running, they're not able to go to work on construction sites and so on, so they're not getting this money that's coming in. There are some states that have announced their own measures for poor people to make sure that they get some kind of income, but there still hasn't been a strategy that's really been announced nationwide, although Narendra Modi did mention poor people in his speech, and it seems that there are likely to be steps to help those people that are living in poverty in India, which is a large percentage of the population here. Mr. Modi, the Prime Minister, did also stress that essential goods, there will be supplies coming through and people will still have access to those. So he's been saying that there's no need to panic. But really, it's a big worry for those poor people in India who don't know where their income is going to come from now. They're not going to those jobs that they normally do. So how do they buy supplies? Because for the wealthy, they can afford to stock up, and that's what they're doing. But for those poor people, they just can't afford to do that.
And Rebecca, while medical professionals in India are preparing for what will probably be a large rise in the number of infections, a lot of them are already being ostracized by communities who fear that they may bring back infections from treating patients. What's being done for doctors and nurses?
Well, this is another major issue in India that one of the reasons it's really had to try and crack down and try and prevent the spread of the virus is that there's an insufficient and limited healthcare system in the country, particularly the public healthcare system, which is already overstretched as it is. There's a shortage of some 600,000 doctors, according to some studies, 2 million nurses, and the public healthcare facilities are often in very poor condition. It's a weak infrastructure here, and that's why India just can't afford for this virus to really spread in a really big way. It just doesn't have the health infrastructure to support that, and it doesn't have the number of ventilators that are needed, and there are reports that show that it doesn't really have the equipment to deal with this virus if it really spreads across the country in a big way. So there have been steps taken by the government. There's been an announcement by the Prime Minister of $2 billion that's going to be injected into the healthcare system, and he's also told the states to make healthcare really their priority now. That's all they should be focusing on. But still, the healthcare infrastructure in India is very limited, and this is really going to put it to the test if these cases rise even further.
India, a country of more than 1 billion people, as I was saying, coming into our conversation, less than 600 confirmed cases of COVID-19 at this point. What are the health professionals telling you about the predictions as far as how this pandemic is likely to develop in India?
The government says it's taking all the necessary steps, and although there have been criticisms by many medical experts who say that India should be doing more testing, because it's really done a very limited amount of testing when you compare it to other countries. In fact, it has one of the lowest testing rates of coronavirus in the whole world, compared to a country like South Korea, for example, which is conducting thousands of tests per day. As of the weekend, India had only conducted some 17,000 tests. So that's really a big concern for many health experts who are saying that more testing should be done to try to uncover more of the cases to try and stop the transmission. So although this lockdown has come into effect, they still think that there need to be more measures taken by the government. Although the government is putting more funds in and it is taking action, there are still those that are quite critical and say that even more does need to be done.
All right, Rebecca Banton, ENCA correspondent in Mumbai, India, for us tonight. Thank you for that update. And still ahead on Nightline, we'll get you an update from Zimbabwe, where the country has 3 COVID-19 cases. Doctors and nurses now on strike.